Hello, Namaste and welcome to Dr. Deepak Jagtap show. Today we are here for the World Homeopathy Conference held in Patna, Bihar. I met Dr.Shaji Kudiyat from Philippines. His book he has presented me and is working on a large scale, especially on cancer. So we are going to discuss treatment of cancer, his approach regarding cancer, and whatever the things they are, they should be focused by the homeopaths or general guideline to approach a case. We will hear from Dr. Kudiyat sir. Welcome, sir, and we'll talk on two types of cancer. India is this Asian countries. We are at top in breast cancer. So how to approach you have for breast cancer patients, as well as what is your experience in past so many years practice?
Yeah, I have treated most of the cases. I treated are breast cancer. I used to practice in India and also in Bangalore city. And most of the cases who came to me, I think that exists in the world also are mostly breast cancer. And these are certain reasons why it is happening. And mostly because see, cancer is treated all over the world without understanding how cancer develops. That fundamental idea is not yet identified. This is because the scientific researches happening today are merely limited to the physical body alone. The physical body has existence in a living condition only when the energy components like a mind and vital force or soul exist within the physical body. These energy components are totally ignored scientifically today by the modern medicine or medical science. And that is the biggest failure because you need to definitely approach with the holistic science basis every living organism. They are not just physical entities. They have energy inside. That energy has tremendous impact and influence in the functioning in the physical plane. So if that is lost, you lost 90% of the working phenomena of a living organism. So we treat cancer without understanding how it develops. So the entire focus today in the treatment happening around the world is considering the tumor developed in the body as part of the cancer. That is not the disease. That is only the byproduct of the disease.
This is
Even though you destroy it through chemo or radiation or remove it surgically, it still come back because there are changes happened in the genetic makeup in the DNA and genes that direct the cells to multiply abnormally. We need to identify who controls our DNA, how the DNA regulation takes place from all possible dimensions and correct it. Then take measures to reverse the process. Then only cutting and throwing the tumor become a curative process. Otherwise, cutting or destroying the tumor will never give results a curative effect as long as the wrongly mutated DNA remains in the mutated state and the condition that result into the mutation will remain there without the patient being aware about it. It will go on producing tumors. You may observe very few people after chemo and radiation escape or may escape from the recurrence of the tumor, not because of the chemo and radiation, but because incidentally the causes that produce the tumor through the DNA where the changes happen unknowingly get out of them through various means when they turn into spirituality and some other means, or the causes they spontaneously get eliminated before there were disharmony in the family or the working environment or within the person that get resolved somehow.
how you deal in your practice, how you deal in Philippines, how you deal with the females when they come to you for breast cancer, or how far is the incidence that they go to some hospital, they get operated and come to you, or in a first prima facie they come to you and you start the treatment? How?
Before I used to get only when it is in the last stage rejected by everybody. Since now I am already in this field for almost 20 more than 20 years, 2 decades. Now I get fresh cases coming directly to me, referred by my patients. So as soon as they got diagnosed, mostly in the allopathy hospital, they come to me by referred by my already cured patients. Sometimes they come directly to me without any other thing. So both happens. And the old way of getting four stages is still happening also. So mixture of all. And if they come in the first stage, first up to third stage, we have tremendous scope. And the fourth stage is the irreversible stage where the scope I put maybe 1 or 2% only.
Okay. And what about the first, second, or third stage? How, I mean, do you you can narrate a case over
Okay.
here? Uh,
See, this is the procedure I do. The most important thing and the most first thing I do is we give a group genetic counseling session. So I am a homeopathy doctor, but I am not just giving medicines, homeopathic medicines alone to the patient. Medicines alone are not enough to cure a cancer, in my opinion. The patient need to know how the patient developed the cancer, and the root causes that produce the cancer should be brought to their awareness, and they need to reverse it. Medicine will do a supportive role only, in my opinion. Identifying and correcting the root causes that made the changes in the DNA that lead to the cancer development is the first thing I wish to do. So though we begin with a group genetic counseling session which explains how the mind, vital force or soul and DNA are interconnected, that give a holistic understanding about cancer development, that will help us to identify and bring to the awareness so that the patient can correct the root causes that lead to the abnormal DNA changes, and help the patient to reverse the condition herself or himself. So this is the first thing I do. Then we do the detailed case taking and do the prescription. Along with that, we do yoga and meditation also, because we have identified certain particular emotions that inflict each organs in our body. So yoga and meditation are to stabilize the mind and help the patient to reverse that negativity exists in that patient that lead to the cancer development, especially inflicting that particular organ. So that particular organ, the emotion connectivity can be 100% identified, but the reason that lead to the development of that emotion will be different in different patients. So we will analyze with the patient and family the environment of the patient living, her philosophy, his philosophy of thinking, and many other homeopathic case taking details.
yes.
And we find the totality of symptoms in prescribing the medicine. At the same time, we will identify the root causes from all possible dimensions and bring to the awareness of the patient and family. Then the continuous counseling sessions will be there, by which the patient will be inspired to help himself or herself to get out of the root causes, and our meditative process will help in reversing, in cancer reversal,
Yeah.
and it is possible.
Yes. And how far, for the homeopaths, and for as per your experience, how to, I mean, for a chronic disease, we preferably go with the lower potencies or like that. So in a fourth stage cancer or a very palliative treatment is needed. Which potencies you prefer in palliative? Is there any difference in palliative line of treatment or aggressive line of treatment? For aggressive line of treatment, if you are correct with the similium, then definitely you must be going for a higher potency. Or this difference, how you
So
look?
in the selection of medicine and the selection of potency, I follow my guru. Guru is a Kerala homeopathy doctor. That is what I follow, and I find purpose, logic, and easiness, and a completeness for an average homeopath to prescribe the medicine and cure the disease. Which I where we not just give a single medicine, we give a constitutional or a miasmatic that is given above 200 potency, 200 or above 200. Then there are organ specific or pathologically indicated, not just a blind prescription, but based on indication, side affinity, modalities, thermal modalities, different ways, indicated medicines. And that also we prescribe organ specifically or location specifically or pathology based.
All right.
That may be 30 or below 30. Then sometimes we need mother tinctures as a supplement in nutrition or some supportive therapy.
For example,
We give, for example, subalcerated tincture we may give in the beginning of a prostate tumor. And in case of this gallbladder cancer or liver, we may start with Cardus marianus tincture, sometimes with the chelidonium, and like that examples. And in hydrastis also, in urinary problems also, similar tinctures some tinctures will be used. So it is a judicious management.
Perfectly.
We cannot, because the principle is that if you give a single simillimum, if it exactly fine, we can give it, no doubt in that. But it is not easy to find the exact perfect simillimum in a rather complicated case.
Exactly.
This
is the point.
Yeah.
What because he is having a more than 20 years practice. I have more than 33 years practice.
I have more than 30 years.
30 years practice. So see, many times I ask two questions in many seminars. Is it easy to find out simillimum? The answer is no. Both questions have got same answer. Is it easy to find out simillimum? Answer is no. Is it impossible to find out simillimum? Answer is no. But in our day-to-day practice, how much time we can spend with the patient? We cannot spend 10 hours
Not
sitting.
only that, there are very talented, highly knowledgeable few doctors in the world may be able to do that.
Yes,
but not an average intellectual, average homeopathy doctor. So when we need to make homeopathy the number one medicine in the world, we not only should follow the classical example of Hahnemann said in an ideal manner, we need to add to that.
Exactly.
See, Dr. Hahnemann, within about 40 years after the discovery of the basic principle of homeopathy, he modified the organon of medicine 6 times.
6 times.
Within a time of less than 50 years.
Yes.
If he have lived 50 more years, how many times he might have modified it?
Yes.
So it is our duty to make this wonderful system of medicine whose help the humanity needs.
Hahnemann was that way. He was a very flexible mind, and he was accepting the things,
everything.
So he never felt ashamed, changing or taking back his statements or adding something new.
Nothing.
So that was exactly, sir.
Because that is why he mentioned in the first aphorism itself.
Yes.
The first aphorism of organon of medicine states, the highest mission of a physician is to cure the patient.
Yes.
Mildly, gently, and the most simplest manner. So our entire motivation should be guided by the first aphorism.
Correct.
That is the first thing. That should be the first thing we keep in our mind when we look at a patient, and we should appropriately make our mind to do that function rather than sticking to certain philosophy he was able to develop during a short period of life.
Right.
So one lifetime is not even enough to complete a medical system of medicine development. It needs multiple generations.
Correct.
So we are the people in the world who understand the fundamentals of that homeopathy to further it, so that the homeopathy become practically applicable to an average homeopathy with an average intellectual capacity, and homeopathy will become most effective and
Yes.
will be available in every nook and corner of the world, so that the potentials of this medicine will be enjoyable to beneficial to every citizen in every country and every nook and corner of the world.
Yes. Sir, decimal scale. I have been using calcarea fluor in case of this malignancy. Calcarea fluor 6x or 12x, phytolacca 30 and 200s, because this is our own experience. These Barata groups, they work better in lower potencies, while these vegetable kingdom phytolacca like drugs, they give good result in 200 or 30 and 200 above. So
So my approach there is that, or my philosophy there is that homeopathy is not only patient specific, it is doctor specific too.
yes,
Because it is a holistic medicine, everything in it is individualistic. A doctor cure a patient not with the medicine alone. The purity of the soul of the patient, doctor will resonate the impure soul of the patient. The concept and attitude and the philosophy of thinking of the doctor will influence the concept and attitude of the patient in the thought developments, because the thought development and philosophy of thinking of the patient has an impact on his or her pathology development. So that philosophy, the doctor will be able to modify it during the consultation, during the case taking, during the counseling sessions, and the trust of the patient in the doctor also. All these are the fundamental curative factors also. Then each doctor will identify the simillimum to correct the remaining damage still remaining.
yes,
Where the medicine can be different, potency can be different. That is the reality of holistic individualistic medicine. So that individualistic, we nowadays talk about the patient specific, but it is not only patient specific, it is doctor specific also, and the homeopathy community should become aware about it, and then only we will be able to distinguish and accept another homeopath, because now sometimes we observe that when 10 homeopaths meet together, their argument, that remedy is correct, this is wrong, and such talks are there. That is absolutely unnecessary, that is
right.
absolutely incorrect and unnecessary also. We need to get out of such things. The homeopathy is not only patient specific, it is doctor specific also.
Yes. So we got good information about approach towards cancer. I thank Dr. Shaji on behalf of our show. Please don't go anywhere. Keep join and do subscribe Dr. Deepak Jagtap show.